Alright, so then let's go to ECG interpretation. So the thing is that changes in wave shapes or timing could indicate, and this is why it's part of a patient monitor. If it starts to change shape or if it starts to change its timing, it could indicate some sort of health problem. So what we have here is the ECG. And actually, in the previous slide, if we have time, we might be able to cover heart rate. But most of the time, like in modern patient monitors, they'll automatically give you a heart rate. The computer already calculates it for you. So again, this is why you have to kind of understand the P wave corresponds to the atria depolarizing and the start of atrial systole. So what we have here are P waves. What we have here is that we have the T waves labeled over here. Now, what do you notice about this? Notice that the P and T, well, you have a set of these 5 waves in each of these cycles, but notice what happened here. Notice this P wave kind of crept up on this T wave, so this wave pattern here kind of crept up and was kind of jumped the gun. It almost runs into the T wave. And this is what we call premature atrial contractions. So PACs they sometimes happen, and it doesn't mean you have to go to the hospital, but if this is something more like recurrent or something that hasn't happened in the past, maybe your doctor might look at your EKGs more and monitor you a little more on the long term. But yeah, so that's what we have here. Premature is kind of jumping the gun. Now let's look at this. Or could an EKG distinguish increased heart rate caused by stress or anxiety compared to irregular? Yeah, so that's why if you have stress or anxiety, it depends on how that stress or anxiety is manifesting on an EKG. If it's just an increased heart rate but everything's pretty regular, they might say, okay, observe you and then say like, okay, does it persist throughout that observation period or does it return back to normal? So again, stress or anxiety shouldn't, if it's like something temporary, I mean, it should go down eventually. Compared to irregular activity, if they monitor you overnight and they see that same pattern occur during some random times, then they might ask you to come back for more observation. Okay, so what we have here is like the P wave, but now look at this part. Is this the P wave or is this the T wave in these EKGs? Like, okay, so we definitely see the QRS complexes, but now we're not sure if these are P's or T's because again, so what we have here is something called paroxysmal atrial tachycardia, or PAT. Now what we saw here is that not only are the P's and T's kind of running into each other, they're running into each other because now the P waves are coming at the QRS complexes. Now these heartbeats are coming really quickly and more spaced together. So you have an increase in heart rate, and this is what's happening here. Now it looks kind of scary and you're like, oh, T's running into P's, is that good? Well, or is that dangerous? Things that paroxysmal refers to almost like an outburst or a fit of something in general in medical terminology. So the good news about this, like even though this looks kind of scary, sometimes it appears and usually it resolves by itself. But if someone's having this kind of like this sort of pattern and it's repeated when they didn't have it before, maybe they have to be monitored more and work with their cardiologist to see if there's some sort of underlying cause. But when this happens, it's not a life-threatening thing most of the time. Usually it kind of resolves itself. Now, what we see here is a different type, and these are all actually cartoons. Most EKGs have much more noise than this, but I think starting out, they're trying to make it very more accessible so that you're not getting thrown off by different patterns. And what we have here is like, okay, where's the P wave? Where's the T waves? We see this kind of like, okay, we definitely see the QRS complexes. These are the very sharp spikes we see here. But everything in between, kind of muddled, right? So Martini is using this as an example of atrial fibrillation, or AFib sometimes for short, or AF. And actually is like, and this always comes up what's the difference between fibrillation and flutter? It deals more with the shape of those pseudo P waves, but that's something that's not quite clear from this picture. So don't worry about the difference between atrial fibrillation and flutter. Concentrate on AFib for this class. Like flutter, I think is a little advanced for this class. All right, so that's talking about all, but what do we notice in here? All of these involve the atria. So something is weird with the P waves, and again, here it's jumping the gun, here it's coming on faster, and here it's like, okay, is it a P, is it a T, what's happening here? So some sort of muddled P wave over there between the QRS complexes. Now let's talk about the ventricles. So again, the QRS complex and the T waves are caused by ventricular activity. The QRS complex is caused by the depolarization and contraction of the ventricles, and the T wave is caused by the ventricles repolarizing and relaxing. Now what we have here, so we have pretty normal complexes over at this point and here, but what's this big scoop, this big dip? And this is what we have here, a premature ventricular contraction. So instead of like it relaxing with this T wave, we have another QRS wave coming in strong. And sometimes so this is what we have here. So is this a P or T? Not sure based on this image. I mean, again, it's a cartoon, so I'm not sure if it's a P or a T. But what we have here is like kind of like instead of the atria jumping the gun, now we have the ventricles jumping the gun. So this is why these two QRS complexes are kind of overlapping and causing this kind of strange shape in the second QRS complex that arrived a little early. So yeah, is there no P? Is there a T? Not sure. Yeah, and actually you can see here, like, not only do you have this kind of weird S scoop, is like, is there another T wave? Is there a P wave? Not sure. Okay, so what we see here is that now we see a more exaggerated version. So we see this kind of like strange overlapping pattern here, but now look at the QRS complexes. Compared to up here, now we see the QRS complexes are coming in faster and overlapping more. So what we have here is ventricular tachycardia. So what we have is like now the ventricles are depolarizing closer to each other or at a faster pace to the point that now these QRS complexes and the P and T waves are starting to overlap. And so what is this tachycardia? And this is why we have to establish what a normal heart rate range is for this class. Luckily, the heart rate range we're using is pretty widely accepted. So for adult resting heart rate, 60 to 100 beats per minute is normal. So we're just talking about adults sitting down and resting. So what we have here with tachycardia, what happened to the heart rate? Did it get faster or did it get slower? So notice that in the atrial tachycardia and ventricular tachycardia, it's starting to get faster and faster, right? And to the point, and it's starting to overlap. So tachycardia, so whenever you see that prefix tachy, it refers to rapid. So it's something that's fast. So what we have here in tachycardia, our definition is going to be an abnormally high resting heart rate above 100 beats per minute. So that will be our definition for tachycardia. And I always found this kind of a fun, I think tachy comes from Greek, and Brady is also, I know when I think of Brady, I think of somebody's name. But bradycardia is just the opposite. So for our class, it will be a resting heart rate below 60 beats per minute. So tachycardia, what we saw is that it increased above normal rates.